Welcome to this Winsome Wealth Medical Aid Review. Now, for most of us, when medical aid review season comes around, we feel like we need a PhD to understand the medical aid brochure. And for that reason, the only thing we really look at is, can I afford the option I'm on or not? Winsome Wealth would like to help you make sense of your rands. We do this by helping make sure that you're getting value for money for what you're paying for medical aid. To do this today, we're going to show you how you can review your medical aid option. We start with looking at 3 different questions. Your first question is, do you have the cover you need? Second question, are you paying for things that you do not need? And final question, are you using what you're paying for? What we want to do is apply this to 4 different aspects of your medical aid option. Your hospital cover, your chronic cover, your savings or annual day-to-day benefit, and your gap cover. So let's start with your hospital cover. Hospital cover is for all those things that covers in-hospital procedures. It's going to cover things like operations, MRI scans, CT scans. So our first question, do you have the cover you need? Important things to look at are limits. Is there an annual limit on the amount that you're covered for if you're admitted to hospital? Or are there limits on specific things like, for example, cancer or a prosthesis for joint replacement? If there are, you need to look at, are those limits realistic? For example, 50,000 Rand for cancer cover may not be enough for a lot of cancer treatments. Our second question, are you paying for things that you do not need? One of the things you can look at here is choice. If you're on an option that allows you to use any private hospital in the country, it's probably more expensive than a network option. On a network option, you are given a list of hospitals from the medical aid that you can use. If you have a look at that list and you find that there's a hospital in your area that you're happy with, you should maybe think about going onto a network option, because then you'll pay less every month on your premium. Final question. Are you using what you're paying for? Here, something that you can look at are procedures that may not be done in hospital, but could still be covered from your hospital benefit. For example, a scope, or perhaps you're having something cut out. The best way to know whether it's covered from your hospital cover is to phone the medical aid beforehand and see if you can authorize that procedure from your hospital benefit. So let's look at our second aspect. Chronic cover. Now, chronic cover is for conditions that are ongoing, such as high blood pressure, diabetes, or asthma. So how can we review our chronic cover? First question, do you have the cover you need? Not all conditions are covered on all options, so you need to make sure that your condition is. And then, even if your condition is covered, the medication that you're taking may not be covered. Every medical aid has a list, which is called a formulary, and that formulary applies to different options. You need to check if your medication is on that formulary or not. Second question, are you paying for things that you don't need? Here you want to look at, are you paying for extensive chronic cover, but you don't need extensive chronic cover? You might then not be on the right option. The second thing you can look at again is networks. If you use a provider that's within the medical aid network, you're often going to either pay a lower premium for your medical aid or less co-payments and levies on your medicine when you get it from the pharmacy. Final question, are you using what you're paying for? Be aware that your chronic medication is not coming from your savings benefit. You have to renew your chronic script every 6 months, otherwise this will happen. Also, if you're having to pay co-payments and levies on the medication that you're using, have a look at the medical aid formulary and see if there's not an alternative or a generic that you could use of that medication. In this way, you're going to avoid your co-payments and levies. So let's look at our third aspect, our day-to-day cover. Now, day-to-day cover is for things like doctor's consultations, dentists, glasses, physio, all of those types of things that happen outside of a hospital. You may have a savings benefit where you get an annual amount that you can apply to those things, or you may have an annual benefit where you get a specific amount for each of those things. Either way, let's apply 3 questions. Number 1, Do you have the cover you need? If you find that you're running out of day-to-day savings halfway through the year, you need to have more. One way you can do this is by optimizing your benefit choice. If you choose the right benefit, you can pay less for things like hospital and chronic cover that you may not need, and rather get more day-to-day cover. Remember, if you have a savings benefit, there's no money in there that you didn't put in. So sometimes the only answer is put more money in. Then, are you using what you're paying for? Don't upgrade an option just to get more day-to-day cover. What you have to understand is that on a medical aid option, 75% or more of what you pay for is for your hospital and chronic cover. When you upgrade your option, you pay more for those things, and you only get a little bit more for your day-to-day cover. So it doesn't really make sense to do it that way. A better way might be to open a savings account at a bank, run a debit order into it, and have a little bit of money put away for when you need to cover medical expenses. Our third question, are you using what you're paying for? Does your option have a threshold benefit? Options like Discovery Comprehensive, Discovery Priority, Momentum Extender, and Bonitas Comprehensive have what is called a threshold benefit. If you're paying for that benefit, you really should be using it. But what exactly is that benefit? Well, a threshold is something that you cross. It's a line. So, for example, a doorway between the inside and the outside. On a medical aid, that threshold is a random amount that you need to cross. How do you cross it? Well, first you have your day-to-day savings. Let's say it's 10,000 Rand. You have to spend all of that money first. Then you have a thing that's called a self-payment gap. And this is when you have to take money out of your pocket and pay for medical expenses. In this example, let's say that self-payment gap is 2,500 Rand. So you've spent your 10,000, now you spend your 2,500. In total, you've spent 12,500 Rand. You've now reached the threshold, that Rand amount. Once you go over that, the medical aid starts paying for certain things again. Now you're using your threshold benefit. What you have to understand about the benefit, though, is that what you spend is only counted at medical aid rates, which means you might spend 500 Rand, but they're only counting 300 Rand. So in reality, you're not going to spend 12,500. You might even spend double that before you reach your threshold. If you're not reaching threshold and making use of that benefit every year, you're probably paying for something that you don't need. Let's go on to our fourth aspect, your gap cover. Gap cover is the insurance benefit that covers shortfalls and co-payments on your medical aid. So how do we optimize gap cover? Our first question, does it cover what you need? Does your gap cover option match your medical aid option? For example, if you have co-payments on your medical aid, does your gap cover cover co-payments? Simple. Second, are you using what you're paying for? Some gap covers have all sorts of add-on benefits like funeral cover or dread disease cover. Do you really need these? And if not, are you paying for them? Make sure you're not paying for benefits that you don't really need and you're rather paying for just what you do need. Our last question, are you using what you're paying for? Here you need to remember you have 6 months from the date of a procedure to claim from gap cover. And gap cover claims are not automatic. You have to put the claim in. It's not linked to your medical aid, so nobody's going to know when you have a gap cover claim unless you contact us and tell us. So we've looked at the 3 questions, we've applied them to each of the 4 aspects. But in summary, how do you get the best value from your medical aid? Number 1, decide what you need cover for. Number 2, check the 4 aspects, apply the 3 questions. Do you have the cover you need or not? If you don't, consider changing your option. But never change your option unless you know exactly what you are losing or gaining from doing so. Once you've had a look at this, if you're still not sure which option you should actually be on, please contact us at Winsome Wealth, and one of our advisors will be happy to help take you through the process and make sure that you're on the best option to get the best value for your money. Thank you for joining us today and enjoy your medical aid review season. Goodbye.